81. What is the effect of rheumatoid arthritis on bone health? A. Increases bone density. B. Reduces bone strength and increases the risk of fractures. C. Has no effect on bone health. D. Neurologist. Answer. B. Reduces bone strength and increases the risk of fractures. Rationale. RA can cause reduced bone density, increasing the risk of fractures, particularly in patients who use corticosteroids. 82. What type of specialist is most often involved in the treatment of rheumatoid arthritis? A. Cardiologist. B. Rheumatologist. C. Endocrinologist. D. High-sugar diet. Answer. B. Rheumatologist. Rationale. Rheumatologists are specialists who diagnose and manage diseases like RA that involve inflammation and autoimmune responses. 83. What dietary recommendation is often given to individuals with rheumatoid arthritis? A. High-fat diet. B. Low-calcium diet. C. Omega-3 fatty acids to reduce inflammation. D. RA causes early pregnancy complications. Answer. C. Omega-3 fatty acids to reduce inflammation. Rationale. Omega-3 fatty acids, found in fish and other foods, have anti-inflammatory properties that can benefit RA patients. 84. How does pregnancy affect rheumatoid arthritis symptoms? A. RA symptoms usually improve during pregnancy. B. RA symptoms worsen significantly during pregnancy. C. Pregnancy has no effect on RA. D. Stroke. Answer. A. RA symptoms usually improve during pregnancy. Rationale. Many women experience symptom relief during pregnancy, possibly due to hormonal changes, but symptoms may return after childbirth. 85. Which of the following is a common comorbidity associated with rheumatoid arthritis? A. Hypertension. B. Cancer. C. Diabetes. D. They are a marker of rheumatoid nodules. Answer. A. Hypertension. Rationale. RA patients are at increased risk for comorbidities, including cardiovascular conditions like hypertension. 86. What is the significance of anti-CCP antibodies in rheumatoid arthritis? A. They indicate an increased risk of stroke. B. They help confirm the diagnosis of RA. C. They help determine the treatment plan. D. Skin pigmentation changes. Answer. B. They help confirm the diagnosis of RA. Rationale. Anti-CCP antibodies are highly specific for RA and are used to confirm the diagnosis, especially in early stages. 87. Which of the following is a common symptom of rheumatoid arthritis in the hands? A. Joint swelling and deformity. B. High fever. C. Severe muscle weakness. D. To repair damaged joints. Answer. A. Joint swelling and deformity. Rationale. RA commonly causes joint swelling and deformity in the hands, particularly in the fingers and wrists. 88. What is the role of corticosteroids in the management of rheumatoid arthritis? A. To cure the disease. B. To reduce inflammation and manage flare-ups. C. To stimulate the immune system. D. To increase muscle strength. Answer. B. To reduce inflammation and manage flare-ups. Rationale. Corticosteroids help reduce inflammation and pain during RA flare-ups, but are not long-term solutions due to side effects. 89. What is the goal of using disease-modifying antirheumatic drugs, DMARDs, in rheumatoid arthritis? A. To provide immediate pain relief. B. To slow or stop disease progression and joint damage. C. To prevent flare-ups. D. Type 2 diabetes. Answer. B. To slow or stop disease progression and joint damage. Rationale. DMARDs are aimed at slowing disease progression and preventing joint destruction in RA. 90. Which of the following conditions can mimic rheumatoid arthritis? A. Gout. B. Irritable bowel syndrome. C. Asthma. D. Observation without treatment. Answer. A. Gout. Rationale. Gout, which is caused by uric acid crystals in the joints, can mimic RA due to similar joint pain and swelling. 91. What is the recommended treatment approach for early-stage rheumatoid arthritis? A. Surgical intervention. B. Conservative treatment with DMARDs and physical therapy. C. Only pain management. D. Shoulder joint. Answer. B. Conservative treatment with DMARDs and physical therapy. Rationale: early-stage RA is best treated with DMARDs to prevent joint damage and physical therapy to maintain joint function. 92. What is the most commonly affected joint in rheumatoid arthritis? A. Hip joint. B. Knee joint. C. Wrist joint. D. RA only affects the knees. OA affects all joints. Answer: C. Wrist joint. Rationale: the wrist joint, along with the hands and feet, is commonly affected by RA due to inflammation. 93. How is rheumatoid arthritis different from osteoarthritis? A. RA is caused by wear and tear, OA by autoimmune reactions. B. RA involves autoimmune inflammation, OA involves mechanical wear. C. RA is more common in older adults, OA in younger individuals. D. Abdominal pain. Answer: B. RA involves autoimmune inflammation, OA involves mechanical wear. Rationale: RA is an autoimmune condition that causes inflammation in the joints, whereas OA is a degenerative condition caused by wear and tear. 94. Which of the following is a common early symptom of rheumatoid arthritis? A. Sudden joint deformities. B. Persistent joint pain and stiffness, especially in the morning. C. Extreme weight loss. D. To promote joint healing. Answer: B. Persistent joint pain and stiffness, especially in the morning. Rationale: early RA symptoms include joint pain, stiffness, and swelling, particularly in the morning. 95. What is the primary function of methotrexate in rheumatoid arthritis treatment? A. To relieve pain. B. To suppress the immune system and reduce inflammation. C. To strengthen bones. D. Increased muscle strength. Answer: B is to suppress the immune system and reduce inflammation. Rationale: methotrexate is a DMARD that works by suppressing the immune system, reducing inflammation, and preventing joint damage. 96. Which of the following is a possible long-term complication of untreated rheumatoid arthritis? A. Decreased risk of heart disease. B. Joint deformities and loss of function. C. Improved lung function. D. Avoiding all forms of exercise. Answer: B. Joint deformities and loss of function. Rationale: if left untreated, RA can cause joint deformities, loss of function, and long-term disability. 97. What lifestyle change is important for managing rheumatoid arthritis? A. Reducing alcohol intake and quitting smoking. B. Increasing sugar intake. C. Eating only protein-rich foods. D. Excessive hair growth. Answer: A. Reducing alcohol intake and quitting smoking. Rationale: smoking and excessive alcohol consumption can worsen RA symptoms, so quitting is recommended for management. 98. Which of the following is a common symptom of rheumatoid arthritis affecting the feet? A. Calluses on the feet. B. Swelling, pain, and deformity in the toes and ankles. C. Numbness and tingling. D. To eliminate the need for medication. Answer: B. Swelling, pain, and deformity in the toes and ankles. Rationale: RA can cause significant pain, swelling, and deformities in the feet, especially in the toes and ankles. 99. What is the role of physical therapy in managing rheumatoid arthritis? A. To cure RA. B. To improve joint mobility and strengthen muscles. C. To prevent infections. D. Hair loss. Answer: B. To improve joint mobility and strengthen muscles. Rationale: physical therapy helps maintain joint function, improve mobility, and reduce stiffness in RA patients. 100. Which of the following is not a common side effect of rheumatoid arthritis medications? A. Gastrointestinal distress. B. Skin rashes. C. Weight loss. D. To stop disease-modifying medications. Answer: C. Weight loss. Rationale: weight loss is not a common side effect of RA medications, whereas gastrointestinal distress, skin rashes, and hair loss are more common. 101. What is the purpose of rheumatoid arthritis flare management? A. To cure RA. B. To reduce inflammation and alleviate symptoms. C. To prevent all joint damage. D. Absence of any immune system involvement. Answer: B. To reduce inflammation and alleviate symptoms. Rationale: flare management aims to control inflammation and reduce pain during active episodes of RA. 102. What is a key feature of the rheumatoid arthritis disease process? A. Progressive joint degeneration due to mechanical wear. B. Chronic inflammation and autoimmunity targeting the joints. C. Sudden, acute joint pain without any long-term effects. D. It only affects physical appearance. Answer: B's chronic inflammation and autoimmunity targeting the joints. Rationale: RA is characterized by chronic inflammation driven by an autoimmune response, particularly in the synovium. 103. How does rheumatoid arthritis impact a person's daily activities? A. It generally does not affect daily activities. B. It can cause pain, stiffness, and limitations in movement. C. It improves mobility and strength. D. It improves heart health. Answer: B. It can cause pain, stiffness, and limitations in movement. Rationale: RA often limits daily activities due to pain, stiffness, and joint mobility issues. 104. What is the impact of rheumatoid arthritis on the cardiovascular system? A. It protects against heart disease. B. It has no impact on the cardiovascular system. C. It increases the risk of cardiovascular disease. D. Persistent low-grade fever. Answer: C. It increases the risk of cardiovascular disease. Rationale: RA is associated with an increased risk of cardiovascular disease due to chronic inflammation. 105. Which of the following is an indication for joint replacement surgery in rheumatoid arthritis patients? A. Mild joint pain. B. Significant joint damage and loss of function. C. Small joint swelling. D. Weight gain. Answer: B. Significant joint damage and loss of function. Rationale: joint replacement surgery is considered when joint damage is severe and significantly affects function. 106. Which of the following is a potential side effect of nonsteroidal anti-inflammatory drugs, NSAIDs, in rheumatoid arthritis treatment? A. Hearing loss. B. Kidney damage. C. Increased bone density. D. Causes glaucoma. Answer: B. Kidney damage. Rationale: prolonged use of NSAIDs can lead to kidney damage, especially in individuals with other risk factors. 107. How does rheumatoid arthritis affect the eyes? A. Causes cataracts. B. Leads to dry eyes and inflammation. C. Improves vision. D. RA always causes severe joint deformities. Answer: B. Leads to dry eyes and inflammation. Rationale: RA can cause dry eyes and inflammation in the eyes, a condition known as Sjogren's syndrome, which is common in RA patients. 108. Which of the following best describes the prognosis for rheumatoid arthritis? A. RA always leads to complete disability. B. RA can vary greatly from person to person, with some achieving remission. C. RA has no impact on life expectancy. D. To stop medication usage. Answer: B. RA can vary greatly from person to person, with some achieving remission. Rationale: RA prognosis varies, with some patients experiencing remission and others developing significant disability. 109. What is the significance of regular follow-up appointments for patients with rheumatoid arthritis? A. To cure the disease. B. To monitor disease progression and adjust treatment. C. To prevent joint surgery. D. Prednisone. Answer: B's to monitor disease progression and adjust treatment. Rationale: regular follow-ups help assess disease activity, adjust medications, and prevent complications. 110. Which of the following is an example of a biologic drug used in the treatment of rheumatoid arthritis? A. Methotrexate. B. Adalimumab, Humira. C. Ibuprofen. D. Of low white blood cell count and elevated platelet levels. Answer: B. Adalimumab, Humira. Rationale: adalimumab is a biologic drug that targets specific molecules in the immune system to reduce inflammation in RA. 111. Which of the following is an indicator of severe rheumatoid arthritis? A. High levels of rheumatoid factor and elevated ESR. B. Low blood pressure and fever. C. Decreased joint mobility and normal blood test results. D. Oral corticosteroids. Answer: A. High levels of rheumatoid factor and elevated ESR. Rationale: Elevated rheumatoid factor and ESR, erythrocyte sedimentation rate, indicate active and severe RA. 112. What is the first-line treatment for most patients with rheumatoid arthritis? A. Nonsteroidal anti-inflammatory drugs, NSAIDs. B. Disease-modifying antirheumatic drugs, DMARDs. C. Biologic agents. D. Tocilizumab, Actemra. Answer. B. Disease-modifying antirheumatic drugs, DMARDs. Rationale. DMARDs are the mainstay of treatment in RA as they slow disease progression and prevent joint damage. 113. Which of the following is an example of a conventional DMARD used for rheumatoid arthritis? A. Etanercept Enbrel. B. Methotrexate. C. Adalimumab, Humira. D. Increased bone density. Answer. B. Methotrexate. Rationale. Methotrexate is a conventional DMARD commonly used as a first-line treatment in RA. 114. What is a characteristic finding in rheumatoid arthritis on X-ray imaging? A. Osteophyte formation. B. Joint space narrowing and erosions. C. Bone fractures. D. Weight loss. Answer. B. Joint space narrowing and erosions. Rationale. X-ray findings in RA often include joint space narrowing and erosions, reflecting chronic inflammation and damage. 115. What is the main complication of using long-term corticosteroids in the treatment of rheumatoid arthritis? A. Osteoporosis. B. Vision loss. C. Joint instability. D. Sudden, severe joint pain. Answer. A. Osteoporosis. Rationale. Long-term corticosteroid use can lead to bone thinning and increase the risk of osteoporosis. 116. Which of the following is a hallmark symptom of rheumatoid arthritis? A. Pain that improves with rest. B. Morning stiffness lasting more than 30 minutes. C. Pain that worsens at night. D. To strengthen bones. Answer. B. Morning stiffness lasting more than 30 minutes. Rationale. Morning stiffness lasting more than 30 minutes is a hallmark symptom of RA, often improving with activity. 117. What is the role of biologic agents in the treatment of rheumatoid arthritis? A. To provide pain relief. B. To suppress the immune system and reduce inflammation. C. To replace damaged joints. D. Hair loss. Answer. B. To suppress the immune system and reduce inflammation. Rationale. Biologic agents target specific components of the immune system to reduce inflammation and prevent joint damage. 118. Which of the following is a common side effect of biologic therapy for rheumatoid arthritis? A. Diarrhea. B. Increased risk of infections. C. Muscle cramps. D. Asthma. Answer. B. Increased risk of infections. Rationale. Biologic therapies suppress the immune system, making patients more susceptible to infections. 119. What is a common comorbidity associated with rheumatoid arthritis? A. Hypertension. B. Osteoporosis. C. Diabetes. D. To stop medication usage. Answer. B. Osteoporosis. Rationale. Patients with RA are at increased risk for osteoporosis due to inflammation and corticosteroid use. 120. What is the main purpose of using physical therapy in rheumatoid arthritis? A. To cure the disease. B. To strengthen muscles and improve joint function. C. To prevent joint surgery. D. To stop medication usage. Answer. B. To strengthen muscles and improve joint function. Rationale. Physical therapy helps maintain joint function, improve mobility, and strengthen muscles, which can reduce pain. 121. Which of the following is a typical early sign of rheumatoid arthritis? A. Sudden onset of fever and chills. B. Swelling in multiple joints, particularly the hands and wrists. C. Rapid weight loss. D. Unexplained bruising. Answer. B. Swelling in multiple joints, particularly the hands and wrists. Rationale. Early RA typically presents with swelling, pain, and stiffness in the small joints of the hands and wrists. 122. What is the significance of the presence of rheumatoid factor in the blood of a patient with suspected rheumatoid arthritis? A. It confirms the diagnosis of RA. B. It suggests another autoimmune disease. C. It may indicate the presence of RA, but is not diagnostic. D. It suggests a viral infection. Answer: C. It may indicate the presence of RA, but is not diagnostic. Rationale: rheumatoid factor is often present in RA, but it is not specific and may be found in other conditions. 123. What is a key feature of the joint inflammation seen in rheumatoid arthritis? A. It typically affects only the large joints. B. It causes asymmetrical joint involvement. C. It is symmetrical and affects smaller joints. D. It primarily affects bones rather than joints. Answer: C. It is symmetrical and affects smaller joints. Rationale: RA typically affects smaller joints in a symmetrical pattern, especially in the hands and feet. 124. What is the role of nonsteroidal anti-inflammatory drugs, NSAIDs, in the management of rheumatoid arthritis? A. To slow disease progression. B. To reduce pain and inflammation. C. To prevent joint deformities. D. To cure the disease. Answer: B. To reduce pain and inflammation. Rationale: NSAIDs help manage pain and inflammation but do not modify disease progression in RA. 125. Which of the following laboratory tests is commonly used to monitor disease activity in rheumatoid arthritis? A. Complete blood count, CBC. B. C-reactive protein, CRP. C. Liver function tests. D. Thyroid function tests. Answer: B. C-reactive protein, CRP. Rationale: CRP is a marker of inflammation and is often used to monitor disease activity in RA. 126. What is the typical age of onset for rheumatoid arthritis? A. Childhood. B. Early adulthood, 20 to 40 years. C. Late adulthood, 50 to 70 years. D. Elderly, 70 plus years. Answer: B. Early adulthood, 20 to 40 years. Rationale: RA typically begins in early adulthood, although it can occur at any age. 127. Which of the following medications can cause or exacerbate rheumatoid arthritis symptoms? A. Antidepressants. B. Antibiotics. C. Certain blood pressure medications, e.g., beta blockers. D. Statins. Answer: C. Certain blood pressure medications, e.g., beta blockers. Rationale: some medications, such as beta blockers, can exacerbate RA symptoms. 128. What is the role of surgery in the treatment of rheumatoid arthritis? A. To cure RA. B. To replace damaged joints or correct deformities. C. To reduce inflammation. D. To strengthen bones. Answer: B. To replace damaged joints or correct deformities. Rationale: surgery is typically used to replace severely damaged joints or correct deformities that cannot be managed with medication. 129. How is rheumatoid arthritis diagnosed? A. Based on symptoms alone. B. Through laboratory tests and imaging studies. C. By a biopsy of the affected joint. D. With a physical exam only. Answer: B. Through laboratory tests and imaging studies. Rationale: RA is diagnosed based on a combination of clinical symptoms, lab tests, e.g., rheumatoid factor, and imaging studies, e.g., X-rays. 130. What lifestyle modification is recommended for patients with rheumatoid arthritis to help manage symptoms? A. Decreasing salt intake. B. Regular physical activity and weight management. C. Eating a high-fat diet. D. Avoiding social interactions. Answer: B. Regular physical activity and weight management. Rationale: regular exercise helps maintain joint function, and weight management reduces stress on the joints, particularly weight-bearing joints. 131. What is the primary aim of rheumatoid arthritis treatment? A. To cure the disease completely. B. To control symptoms and prevent joint damage. C. To increase joint flexibility. D. To stop joint pain temporarily. Answer: B. To control symptoms and prevent joint damage. Rationale: the primary goal of treatment is to control inflammation, manage symptoms, and prevent irreversible joint damage. 132. What role does smoking play in rheumatoid arthritis? A. It has no impact on RA. B. It reduces disease activity. C. It worsens disease activity, and increases flare-ups. D. It helps manage symptoms. Answer. C. It worsens disease activity and increases flare-ups. Rationale. Smoking is a known risk factor for the development and progression of RA and can worsen symptoms and flare-ups. 133. What is the main cause of joint damage in rheumatoid arthritis? A. Physical injury to the joint. B. Chronic inflammation of the synovium and cartilage degradation. C. Poor posture. D. Infection in the joint. Answer. B's. Chronic inflammation of the synovium and cartilage degradation. Rationale. The chronic inflammation in RA leads to joint destruction through synovial inflammation and degradation of cartilage. 134. What is the primary difference between juvenile idiopathic arthritis, JIA, and adult rheumatoid arthritis? A. JIA only affects the knees. B. JIA affects children and is typically milder than RA. C. JIA is caused by infections, while RA is autoimmune. D. JIA has no treatment options. Answer. B. JIA affects children and is typically milder than RA. Rationale. JIA is the pediatric counterpart of RA and often presents with milder symptoms compared to adult RA. 135. Which joint is most commonly affected in rheumatoid arthritis? A. Shoulder. B. Knee. C. Hand joints. D. Ankle. Answer. C. Hand joints. Rationale. The small joints of the hands, including the metacarpophalangeal and proximal interphalangeal joints, are commonly affected in RA. 136. What is the purpose of using corticosteroids in the treatment of rheumatoid arthritis? A. To cure the disease. B. To reduce inflammation and manage flare-ups. C. To increase bone density. D. To improve joint flexibility. Answer. B. To reduce inflammation and manage flare-ups. Rationale. Corticosteroids are used to quickly control inflammation during flare-ups and to manage acute symptoms in RA. 137. What laboratory test is commonly used to detect inflammation in rheumatoid arthritis? A. Prothrombin time, PT. B. C-reactive protein, CRP. C. Hemoglobin level. D. Complete blood count, CBC. Answer. B. C-reactive protein, CRP. Rationale. CRP is a marker of systemic inflammation and is often used to monitor disease activity in RA. 138. Which of the following is a common extra-articular manifestation of rheumatoid arthritis? A. Asthma. B. Rheumatoid nodules. C. Gallstones. D. Chronic sinusitis. Answer. B. Rheumatoid nodules. Rationale. Rheumatoid nodules are firm lumps that form under the skin, often over pressure points, and are a common extra-articular manifestation of RA. 139. Which of the following is the most common cause of death in patients with rheumatoid arthritis? A. Stroke. B. Infection. C. Liver failure. D. Heart disease. Answer. D. Heart disease. Rationale. Patients with RA have an increased risk of cardiovascular disease due to chronic inflammation and other factors. 140. What is the main mechanism behind joint damage in rheumatoid arthritis? A. Bone degeneration from increased physical activity. B. Chronic inflammation and immune system activation. C. Viral infection of the synovium. D. Decreased blood flow to the joints. Answer. B. Chronic inflammation and immune system activation. Rationale. RA is an autoimmune disease where chronic inflammation damages the synovium, leading to joint destruction. 141. Which of the following medications is commonly prescribed to reduce disease activity in rheumatoid arthritis? A. Hydroxychloroquine. B. Methotrexate. C. Insulin. D. Statins. Answer. B. Methotrexate. Rationale. Methotrexate is a DMARD that reduces inflammation and slows disease progression in RA. 142. What is the role of the nurse in managing a patient with rheumatoid arthritis? A. To administer medication and monitor side effects. B. To cure the disease. C. To prescribe pain medications. D. To manage all aspects of the disease. Answer. A. To administer medication and monitor side effects. Rationale. Nurses are responsible for administering medications, monitoring for adverse effects, and educating patients on disease management. 143. How is rheumatoid arthritis different from osteoarthritis? A. RA is due to wear and tear, while OA is an autoimmune condition. B. RA is inflammatory, while OA is non-inflammatory. C. RA affects only the knees, while OA affects hands. D. OA has systemic symptoms, while RA is localized. Answer. B. RA is inflammatory, while OA is non-inflammatory. Rationale. RA is an autoimmune, inflammatory condition, while osteoarthritis is a degenerative, non-inflammatory joint disease. 144. What is the impact of early treatment of rheumatoid arthritis? A. It has no effect on the disease progression. B. It can significantly reduce the risk of joint damage and disability. C. It causes more frequent flare-ups. D. It only improves pain but does not affect disease progression. Answer. B. It can significantly reduce the risk of joint damage and disability. Rationale. Early treatment with DMARDs can prevent joint damage and improve long-term outcomes for RA patients. 145. Which of the following is a common physical therapy intervention for patients with rheumatoid arthritis? A. Aquatic therapy. B. Weightlifting. C. High-impact aerobic exercises. D. Bed rest. Answer. A. Aquatic therapy. Rationale. Aquatic therapy is often recommended as it allows low-impact exercises that improve strength, mobility, and reduce pain in RA patients. 146. What is the main goal of using disease-modifying antirheumatic drugs, DMARDs, in rheumatoid arthritis? A. To provide immediate pain relief. B. To reduce inflammation and slow disease progression. C. To promote weight loss. D. To increase bone density. Answer. B. To reduce inflammation and slow disease progression. Rationale. DMARDs target the underlying disease processes of RA, slowing progression and preventing joint damage. 147. Which of the following is the most common joint deformity seen in rheumatoid arthritis? A. Hallux valgus. B. Ulnar deviation. C. Finger contractures. D. Knee buckling. Answer. B. Ulnar deviation. Rationale. Ulnar deviation, where the fingers deviate towards the ulna, is a common deformity in RA due to joint destruction. 148. What is the main characteristic of the synovial fluid in rheumatoid arthritis? A. Increased viscosity. B. Decreased white blood cell count. C. Increased white blood cell count. D. Normal appearance and composition. Answer. C. Increased white blood cell count. Rationale. Synovial fluid in RA often contains increased white blood cells due to inflammation and immune system activation. 149. What lifestyle change is recommended for managing rheumatoid arthritis symptoms? A. High-protein diet. B. Smoking cessation. C. Avoiding exercise. D. Increased alcohol consumption. Answer. B. Smoking cessation. Rationale. Smoking exacerbates RA symptoms and increases the risk of developing the disease. Cessation is crucial for managing RA. 150. What is the typical course of disease in rheumatoid arthritis without treatment? A. It leads to complete recovery without complications. B. It progresses with joint damage and disability. C. It remains stable with no symptoms. D. It worsens temporarily before improving. Answer. B. It progresses with joint damage and disability. Rationale. Without treatment, RA typically leads to progressive joint damage, deformities, and loss of function. 151. What is the first-line treatment for a patient with newly diagnosed rheumatoid arthritis? A. Biologic agents. B. Methotrexate. C. Prednisone. D. NSAIDs. Answer. B. Methotrexate. Rationale. Methotrexate is the first-line treatment in RA due to its effectiveness in reducing inflammation and slowing disease progression. 152. Which of the following is an important aspect of nursing care for patients receiving biologic therapy for RA? A. Encourage regular sun exposure. B. Monitor for signs of infection. C. Ensure strict bed rest. D. Limit fluid intake. Answer. B. Monitor for signs of infection. Rationale. Biologic therapies suppress the immune system, increasing the risk of infections, so careful monitoring is necessary. 153. What is a common complication of rheumatoid arthritis that affects other organs besides joints? A. Stroke. B. Vasculitis. C. Asthma. D. Heart failure. Answer: B. Vasculitis. Rationale: RA can lead to vasculitis, an inflammation of the blood vessels, which can affect multiple organs. 154. Which of the following is true regarding the genetic component of rheumatoid arthritis? A. It is not genetically inherited. B. The presence of certain genes increases the risk of developing RA. C. It affects only men and not women. D. It is caused by viral infections. Answer: B. The presence of certain genes increases the risk of developing RA. Rationale: certain genetic factors, especially the presence of HLA-DR4, can increase the susceptibility to developing RA. 155. Which of the following should be included in patient education for rheumatoid arthritis management? A. Increasing high-impact exercises. B. Smoking cessation and regular exercise. C. Avoiding all forms of physical activity. D. Eating a high-fat diet. Answer: B. Smoking cessation and regular exercise. Rationale: smoking cessation and regular, low-impact exercise are key components of managing RA and improving overall health. 156. What is the impact of obesity on rheumatoid arthritis? A. It has no effect on disease activity. B. It can worsen inflammation and symptoms. C. It improves joint function. D. It reduces the risk of flare-ups. Answer: B. It can worsen inflammation and symptoms. Rationale: obesity increases systemic inflammation, which can exacerbate RA symptoms and disease activity. 157. What is the purpose of rheumatoid arthritis medications such as biologics and methotrexate? A. To cure the disease. B. To modify the immune response and reduce inflammation. C. To improve joint mobility. D. To treat only acute flare-ups. Answer: B. To modify the immune response and reduce inflammation. Rationale: these medications work by modulating the immune response to reduce inflammation and prevent joint damage. 158. Which of the following is a common side effect of methotrexate treatment for rheumatoid arthritis? A. Weight gain. B. Liver toxicity. C. Increased energy. D. Increased bone density. Answer: B. Liver toxicity. Rationale: methotrexate can cause liver toxicity, so regular liver function tests are necessary during treatment. 159. What is a common sign of rheumatoid arthritis in its early stages? A. Sudden joint deformity. B. Joint stiffness and pain, especially in the morning. C. Decreased joint swelling. D. Fever and weight loss. Answer: B. Joint stiffness and pain, especially in the morning. Rationale: morning stiffness and pain are hallmark symptoms of early RA due to inflammation in the joints. 160. How often should patients with rheumatoid arthritis be monitored for disease progression? A. Once every few years. B. Once a month. C. Every 3 to 6 months. D. Only during flare-ups. Answer: C. Every 3 to 6 months. Rationale: regular monitoring every few months is necessary to assess disease activity, medication efficacy, and potential complications.